Hi, I'm Hazel. I'm here with the program on the environment at UW, and my site partner was UW Medicine, where I work directly with my site supervisor, Gabriella Henkels, and through UW, my faculty advisor was Chris Mantanga. My project is titled Sustainable and Safe Redefining Healthcare Without Compromise. In medical settings, the primary focus is on one's immediate physical health. If someone comes in with an injury or an allergic reaction, the number one priority at that moment is to make sure that they are safe and healthy and alive. Unfortunately, a lot of the usual sustainable alternatives used elsewhere is not possible to be used in medical settings because of health risks. However, sustainability and health can thrive together, and one does not need to decrease for the success of the other. As of now, current medical practices are contributing to large amounts of greenhouse gas emissions, which cycles back to negatively impact human health. So it's a bit of a negative cycle that's going on. As you can see in figure 1, the internal circle of climate change flows to various environmental impacts that then goes out outwards of the figure and negatively impacts human health. In 2009, 10% of carbon emissions in the US were from healthcare. The very system that is in place to protect human health is contributing to an issue that puts them in harm. As climate change worsens, the US is not properly equipped to deal with more environmental health impacts with how the system is set up right now. So while it is important to keep focus on immediate health, it is just as important to prioritize prevention, which starts with sustainability. So for this project, I asked myself the question, how can hospitals operate more sustainably without interfering with safe medical practices? For my capstone internship, I worked with Harborview Medical Center to help complete a Practice Green Health Sustainability Award application. And Practice Green Health is an organization that works to improve sustainability in hospitals all across the country. And part of their work is giving out awards to improve medical sustainability and giving out awards to hospitals that are currently behaving in sustainable ways. So for the application, I had to conduct interviews and send data requests for the following categories. I was in charge of food, sustainable procurement, leadership, transportation, chemicals, greening the OR, climate, and energy. In figure 2, you can see the logos. This is from the Practice Green Health website, and each represents an area of the application. Now, there are 11 areas, so the other ones that I did not specifically cover, my site supervisor did, are waste, water, and green building. As for my personal research, I conducted a literature review on sustainable practices in the medical field. International examples of medical sustainability, ways to reduce carbon emissions through different practices, and health impacts are just a few of the topics I found and was able to research. The main outcome of my research was the realization that the 11 areas covered can, for the most part, be divided into two sections. As outlined in figure 3, the two sections are individual versus institutional action. Um, Food, leadership, climate, and transportation can see great changes through individual action, such as using public transit, saving and not wasting food in the hospital, or spreading environmental education. On the other hand, water, greening the OR, green building, chemicals, sustainable procurement, and energy primarily need institutional action to create differences, such as changing supply vendors, reworking machinery, or reducing unnecessary chemical usage. And as you can see in the figure, waste falls into both categories a bit because it's such a broad topic and kind of relates to all the other categories as well. I believe that one of the biggest barriers to individual action is the lack of education. With more knowledge, people can deepen their understanding of their personal impact on sustainability through the medical field. In regards to the employees, there's a current feeling of insufficiency of knowledge and sustainability and their impact. But when I did my interviews, every single person that I talked to showed a deep understanding and care for the environment. Um, a lot of the skepticism and lack of hope leads to sustainable action being unable to be complete because people often think it's just not possible, so why try sort of mentality. Um, some examples of actions that could be taken at hospitals that I learned from my research and my time at Harborview would be shutting doors when possible to preserve energy flow, reducing single-use products when possible, or using public transportation to get to and from the hospital for employees or patients. Most of the solutions in this sector are more directly applicable to healthcare and healthcare behaviors, but overall have a lower impact in comparison to institutional. Because On the other hand, there is institutional action, which is not always specific to the in-person healthcare practices or things that employees or patients can solve by altering behavior. They're more, as the title says, institutional. Um, some solutions I learned about through my research and my time at Harvard Review for this section is um, ordering more sustainable vendors to reduce waste, using more reusable energy sources when possible, and reducing unnecessary chemical waste. So, alternatively to individual action, these are less directly applicable to healthcare action, but have a greater impact in the long run. So what does this all mean? Well, it furthers the proof that there will be multiple benefits to using sustainable alternatives when possible. Some of the big ones are saving energy and chemicals and reducing waste, and all of those in the long run will save you money because you're spending less money on things that are disposable. It's a lot of reusable alternatives, which saves money, which is unfortunately usually the driving factor in how decisions are made. So there's the economic gain, and then there's also just the general environmental gain for being more sustainable in hospitals. Um, Additionally, when doing my research, there wasn't as much information as I expected, which leads me to claim there needs to be more research to further prove that sustainable alternatives are present and possible and important. In relation to my results, as I mentioned earlier, I think that sustainability education should be required in either medical schools or before onboarding any employees to hospitals and doctors' offices. Just like other areas of training you get when you're starting a new job, I think it should be treated like something that everyone has to do. So for patients, that's a little bit different. I would say that's more for the employees, and for patients, I think there needs to be an increase of signage to indicate where things can be thrown away or recycled, or information on the nearest public transportation services for them, or anything that will improve individual action and alter behavior to benefit the sustainability of the hospital. As I mentioned before, sustainability and health can exist at the same time with the right efforts. Yeah, I want to say thank you to Gabriella Henkel as my site supervisor, my faculty advisor, Chris Mantega, my POE cohort, and my family and friends for their continued support and the feedback. Thank you.